I am speaking with our state Senator Bruce Tarr, as I do every week. Senator, it's been a tough week.
It sure has, Heather. It's good to be with you to talk about it, but it has been a very trying week so far, and it promises to continue to be so.
So tell us, it's all about vaccines. The public are frustrated, the governor's frustrated.
So there is a lot of frustration out there. Obviously, people want to get vaccinated, and that's important because early on, one of the thoughts we had was about how proliferate we'll be able to make the vaccine so that we can develop herd immunity, which is one of the keys to fighting the spread of COVID-19 and pushing back toward a new normal. That has not been a concern now as we have folks who want to get vaccinated. The problem more is trying to get them vaccinated. And so one of the struggles that we face, and this is the biggest issue, is trying to get enough vaccine. And there's only one source. We can only get it from the federal government. We were at around 86,000 doses a week. That ratcheted up to about 101, then to about 120. And I'm told that this week we can expect to get 130, 135,000 doses. But that is a far cry from what we have the capacity to vaccinate with. And so you've seen super sites develop around the state. Obviously, there have been a lot of local initiatives that are very important as well in my mind, but there is not enough vaccine to meet capacity. And I've heard estimates of our capacity that range to around 300,000 vaccinations a week. And when you're only getting, let's say, maximum 135,000 doses, it makes it very, very hard. Because what winds up happening is difficult decisions have to be made around how too low a supply of vaccine is going to get distributed to very eager participants that want to be in the vaccination business. And so what has happened is we've seen, number one, the site collapse initially relative to making appointments. That's been largely remedied. But that being said, and there's still improvements being made to the site, there's nothing that can compensate for having enough appointments. And so people can get on the site, they can try to find an appointment. We still don't have enough. So that's problem number one. Problem number two is what have been, by all accounts, very successful local vaccination efforts, like the one that's being run at the Elks by Beth Israel Lahey Health, or the ones that have been run by the local councils on aging and boards of health. You had one in Rockport. There was one in Gloucester at Cruiseport this past Saturday that, believe it or not, did over 900 vaccinations. Those sites are now being constrained. And as you recall, initially, each community was getting 100 doses. That was changed so that now they aren't getting the 100 doses, and new rules have been set that encourage communities to collaborate. But when they collaborate, they still have to reach very high numbers, which may not be sustainable for a local cluster of communities to develop a regional vaccination site. So there are a lot of problems, and we are working very hard to be able to try to address those to make sure vaccines are still available locally, as well as at the super sites. And I will tell you from my perspective, the super sites play a role. They can vaccinate large numbers of people quickly, and that is important to getting herd immunity. But the local sites play a role too. And we need to make sure that the most vulnerable of our population, who may be homebound or have limited mobility or can't stand in a line for a long period of time, we need to be able to reach them. And that isn't going to happen at a super site.
So I just want to summarize. It sounds as if the governor is concerned that there is just not enough efficiency in distributing a limited supply of vaccine when you start using a community-based program. So he last week made this decision to move everything to these super sites. Is that right?
To reallocate vaccine. And so the decision was basically made to take the allocation away from individual communities and reallocate it to the super sites. But at the same time, the decision was made to allow regional local collaboratives to exist if they meet certain criteria. The problem is those criteria will be hard for a lot of regional collaboratives to meet.
So if we were to have a regional collaborative in Essex County on Cape Ann, what would we need to do?
So it's important to understand we're already served by the mass vaccination site at the Doubletree Hotel in Danvers. So I don't think that we'd be a candidate on Cape Ann for another site of that size, but we are on Cape Ann an ideal geographic location for a regional site. And what we would need to do is develop a proposal and put that proposal before the Department of Public Health and get a certification to be eligible to get doses. And I've convened a meeting, and Representative Hill and Representative Ferranti are going to participate in this as well. We talked about it, and we decided that it would make sense for us to start a conversation among the 4 Cape Ann communities and the folks at Addison Gilbert Hospital to talk about what we can do to have a Cape Ann site. And that meeting is scheduled for this week. I don't know what will come of it, because obviously everyone would have to agree, but it makes sense for us to have the discussion. And one of the folks that was suggesting that is Rockport Chair of Board of the Selectmen, or Select Board Chair, Ruth George, who said, we have capability. Why don't we try to do this in a regional way? So we are working to have that conversation.
So what would be your argument to, I understand there's certain criteria you have to meet, but what would be the argument? I don't know, do you propose this to the governor to say, we think our regional collaboration is necessary because of this? What would that be?
So first of all, let me tell you that 2 of the most daunting criteria that have been articulated is having to do 750 vaccinations or more in a day, and having to be open essentially from 9 to 5, so business hours. That is really hard for communities at the local level to sustain for any period of time. So our argument would be that we have a very well-defined geographic area in which we can reach those that would have a hard time, as I described, getting to a super site, folks that are older, that are less mobile, that have other physical constraints where they just can't get to a site. And we think that we can operate efficiently to be able to get to that population that we need to reach, because they're more vulnerable in many cases than the rest of the population. And if we don't reach them, then we'll be setting the stage for transmission of COVID-19. And if we can agree on this proposal, that's the argument we will make, that we may not be able to reach the numbers of the larger sites, but we can reach a very distinct group of people very efficiently.
So how many people are being vaccinated in these super sites at this point? Do you know?
I don't have a good estimate for that. I've heard very, very large numbers, in the thousands, and, in a given day. And so that's certainly a lot. And again, I would be the first to tell you, I think there is a role for those sites, for folks that are ambulatory and have the ability and the energy and the wherewithal to be able to get to those sites. They play a very important role at vaccinating large numbers of people, but they can't be the only way that we do it, because it simply leaves out a segment of our population.
Right, and this may not be as applicable to Cape Ann, but there are also people who just don't have a car and don't have access to a computer either, which both of those you would need.
Exactly, and that is those are huge examples of the kind of constraints that some people face that we're trying to address. I also would point out something else, Heather. Something that folks may not be aware of is that CVS and Walgreens get their allocation of vaccine directly from the federal government. They do not get it as part of the state's allocation. And so an issue has been trying to track that and account for it. My understanding is that when they vaccinate someone, that information goes into the state database, but how many doses they're getting in advance does not. And there's been some work to try to improve that, because again, that fragmentation doesn't help us to understand the entire nature of what we're doing in Massachusetts.
Well, you said you've been flooded with calls from constituents. What are they talking about?
All manner of things. Folks have had frustration with the site to be able to register for an appointment. We've been working on that. There have been some improvements that have been made. So for instance, having the site save your information so that you don't lose it if something goes wrong, that's a big example of. The other thing that we've heard a lot about that's being worked on is someone starts to make an appointment, and by the time they finish with their information, that appointment's been filled with someone else, and that's extremely frustrating. We've heard a lot about folks just having problems getting to the super sites. We've heard frustration, and I share this frustration, with the site being run at the Elks not being able to continue, because it's been very, very effective at getting to a group of people that are in the Beth Israel Lahey Health database, that can go locally to get a vaccine. And we've also heard, again, from folks who just want communities to be able to keep doing the vaccination at the local level. And I understand that concern as well. So we're trying to work as quickly as we can to identify those concerns, to document them, and then to address them one at a time.
So, is there any update on the chaperone policy that was initially a bit of a problem when it was perhaps being abused?
I don't have an update on that. I know that the governor had issued basically a warning to folks to be careful with regard to that. I don't have any further information at this time.
And do you hear any conversations about the possibility that people may only need one part of this vaccine?
I have heard that, and I've heard it in the context of, unfortunately, folks that may get frustrated and not return for the second vaccine. And the question is the first one that they got effective? And I know that that helps you to develop some immunity. I'm not a doctor, I'm not a public health expert, so I can't comment any further than that. But there has been concern about that issue, about getting the second vaccine, as well as the time frame. And apparently the CDC has indicated that you may have a longer time to get the second vaccine to have it still be effective than was originally thought. And that's come into the play in some of the thinking around appointments and scheduling them.
Hmm. Well, what else do you want your constituents to know about?
Well, I
Um,
want everyone to know that we're here. And if you can reach us by email, you can reach us by telephone. I would ask folks to have patience because we are receiving a very large volume of contact. But I am committed and my staff is committed to being able to answer everyone's questions and concerns and to help if someone has a problem navigating the state system. Obviously, there's a 211 phone line that's been established for those that are over 75. But if you have a problem and you think we can help you navigate, please call us. But again, the thing I would ask for is patience. We do want to help everyone, but the volume right now is creating a challenge.
all right. Well, thank you so much and good luck this week. We will talk to you again next week.
Thank you. We look forward to talking with you again next week and hopefully giving you a report not only on this, but also on the legislation that we've all been filing in the House and the Senate.
I'm looking forward to hearing about that.
All right.
Okay.
Thank you, Heather.